Greetings, AIS family. I trust that everybody is well rested. I am Mrs. Mina Danso, also known as Sweetness Danso, and I'm really excited and honored to have this opportunity to talk to you about lupus. The month of May is Lupus Awareness Month across the nations of the world, and lupus warriors try to create as much awareness as possible for this debilitating autoimmune condition that most people suffer undiagnosed until sometimes it is too late. So we'll be talking about what lupus is, what are the symptoms, how is it diagnosed, which kind of people get lupus, and then I'll share a little bit about my experience with lupus. Before we delve into that, I would like to sing our school anthem. It's been such a long time since I sang it, but I hope I do get it right. Glad that I live on mine, that the sky is blue. Glad for the country live and the fall of dew. After the sun, the rain. After the rain, the sun. This is the way of life till the world began. Each nation gathered here, we are brothers all. Friendship and loyalty, we will find our school, learning to take our place, whatever creed nor race, joyful in all we do, each and every day. Oyemam Autoimmune Foundation, in collaboration with S4C Music, released a single track on Mother's Day, which also happened to be World Lupus Day, and it's a song of hope that is dedicated to all lupus warriors around the world, who are about 5 million, and all people who are battling with COVID-19 infections and other kinds of sicknesses. And the song is dubbed At the Mention of Your Name, that there is hope in the name of Jesus. So it's on SoundCloud, it's on iTunes and other platforms, and we would like you to download it, share, and let's spread the hope and diminish the fear. Thank you. So I will joyfully talk to you about lupus now. So who is Sweetness? Sweetness is a young lady that has been battered by lupus. I was living my normal, happy life, and then all of a sudden I started experiencing symptoms that I could not place a finger on, and the doctors also could not identify what it was. And it lingered for years. There were times that I would have flares, and it will look like that's your last day on the earth, but somehow by divine providence I would recover. And 7 years after all the struggles with the different kinds of health challenges, it was diagnosed to be systemic lupus erythematosus, which is a kind of lupus, and of course the most dangerous type of lupus that we have. So I do take, since 2007, I have been on medications. In 2000, when I was diagnosed, I was put on stronger medications, which are also very expensive. And I also had to resign from my work because of the challenges that the disease brought into my life. But by the grace of God, out of the pain and out of the agonies that I have experienced, a non-profit was birthed, which is called Oyemam Autoimmune Foundation. Oyemam meaning that it is well. An autoimmune foundation to create awareness, to advocate for the necessary policy changes to help people with autoimmune diseases like lupus get support in this nation, because it is very, very unknown, and the NHIS does not support our medications, which are very expensive. And as a chronic condition, people have to live with it for the rest of their lives until God Himself intervenes. And so that is what Oyemam is doing, and this is one of the ways that we are spreading awareness. And thank you so much for your audience. So now, what is lupus? I would just like to say briefly that we have our security services in Ghana who are supposed to protect civilians and the nation from foreign invaders. Now, something could happen, and then the security forces can become confused. Let's say the police officers who are supposed to maintain law and order get up tomorrow morning, and then they can't tell the armed robber from the market woman that is doing her job decently, and then they just open arms on them. That is what happens when an autoimmune condition happens, sets in. So something could trigger the immune system to become confused, and so it cannot identify that this is part of myself that I have to protect, and this is a foreigner that I have to fight against. And lupus is one of the most deadly kind of autoimmune diseases that a person can suffer. Now, there are different types of lupus. We have the systemic lupus erythematosus, which is commonly called SLE. For that, it affects the whole human system from your head to the soles of your feet. It can decide to attack any part of it, and there is no cure and there's no known cause for it. Then we have the discoid lupus erythematosus, which mostly affects the skin and the cutaneous part of the body, so more characterized with rashes and stuff like that. And then we also have drug-induced lupus, which a person develops when they are on a certain medication for a long period of time. That is curable by just stopping that kind of medication. And then we have neonatal lupus, which can affect babies, and usually could affect their heart or get some rashes, and sometimes the rashes can go, but it can also be fatal. So those are the types of lupus that we have. Like I said earlier, there's no known cause for lupus. However, there is enough knowledge to show that there are certain things that trigger the lupus condition in a person. And what are some of these things? Some of the things that can trigger lupus include just the fact that you're a female and you have a certain kind of hormone. So 90% of people who suffer from lupus are women, and just about 10 are men, because of the hormones that we produce as women. And most of the women that are affected by lupus are women within their reproductive age of 15 years to 44 years. So once you hit that childbearing age and that hormone production is increased, there is the potential that if the right factors are in place, the person can develop lupus. And then there's also the genetic susceptibility. So one thing about autoimmune diseases is that they cluster in families as different kinds of autoimmune diseases. So somebody can say, oh, my grand auntie had rheumatoid arthritis, and there's somebody in my family that had multiple sclerosis or myasthenia gravis. At any point in that family history, somebody can develop lupus because there is some kind of autoimmunity in that line. And then we also have environmental factors. These environmental factors put stress on the body, and there are different kinds of environmental factors that stress the body. It could be from all the emotions that send negative energy into the body. It could be from anger, from broken heart. It could be from anxiety and all other similar ones. And then we also have toxins from the environment and chemicals. Now we are all exposed because you actually don't know what chemicals are being used to plant the food that we eat. A lot of genetic modifications, a lot of chemicals are being used in growing the crops, in preserving them. And so we can't really control some of these things, and some of these decisions are political decisions that we even don't have choices over. For example, we have COVID-19. Very soon, by God's grace, we are all hoping that they're going to get a vaccine. Now, when that vaccine is introduced, you really cannot say that you will not take the vaccine. It's a political decision that you may not have any control over. Assuming you want to go to a country in Europe and they tell you that you can only come here if you have the vaccine. Will you cut your trip, or you will take the vaccine and go? And when you take the vaccine, do you know what kind of reaction that it's going to have on your body based on your immune makeup and how your immune system is going to take it? So these are some of the things that we have no control over that can affect our immunity and cause autoimmunity. Some people can get trigger autoimmunity in their system from electromagnetic waves, from all these massive masks that the telecoms are putting, and even from our own use of electronics. Some people use their phones. Their phones have to be with them 24/7. It has to be under their pillows when they are sleeping, and all these kinds of things. So many different things trigger this autoimmunity. And then the other thing is, apart from, so I've spoken about toxins, I've spoken about the chemicals, I've spoken about our emotions, I've spoken about hormones, and we also have of course, I talked about the drug induced ones, so the certain kinds of drugs that you're taking. And then how lupus is diagnosed. You're going to use the symptoms that you're presenting when you go to the hospital. They will also have to check your family history, and then they will do your blood work. They will do urine analysis to see how your immune system is responding, to see the activity that is going on. And mind you, Black people get a lot of organ damage from lupus and a lot of kidney problems. So all these are checked. Now I'd like to talk about the symptoms of lupus. They are so varied because lupus does not affect any two people the same way, because what you are predisposed to is different from what I am predisposed to, and my genetic makeup is different from yours. So somebody's lupus can be attacking their heart, another person can be attacking their kidney, another person's can be attacking their skin. And so the symptoms are so wide ranging, and that is why it's been difficult to find exactly what causes it and to develop a cure for it. And so somebody could be having fever, and another person could be having headaches. Someone will be having blood clots, confusion, anxiety, organ damage, itching. Somebody could be having backache. Somebody will be having dizziness, skin rashes, especially with the discoid. There's a symbolic butterfly rash that goes across the nose, and so lupus, that's why they use the symbol of a butterfly, kind of a lot of hair loss, a lot of weight loss, and then skin discolorations. You can have all kinds of things happening to your skin. And then you can have mood swings. So sometimes you can be with somebody and then they might think, oh, you're a tune-on person, or you are they can just brand you or stigmatize you without really knowing why you are behaving the way you are. So another time when you are just gay and happy and maybe you want to relate, they will feel like, yeah, after being moody and everything, now you want to relate. But because they do not understand that there's an underlying medical condition that causes you to react that way, it's difficult for people to relate well, and that makes the lupus journey really, really lonely. Also, apart from that, you can have the side effect of even some of the medications that you take, so there are medications that can give you ulcer and other kinds of things, and you have to take other medications to counteract the side effects of those ones. What are some of the medications lupus patients take? We take steroids, we take anti-malarials like hydroxychloroquine, we take immunosuppressants like Celcept, which is also called mycophenolate mofetil. Some lupus patients have to go to chemotherapy, some have to do organ transplants. I have friends who have kidney transplants. Some have to do all kinds of graftings and stuff like that, depending on where you've been affected. If it messed up your skin so bad, or giving you some ulcer somewhere, the kinds of treatments that have to be given to you. And then you also need to take a lot of supplements. So vitamin C is a necessity, vitamin D, because a lot of people are deficient in vitamin D, and so you need to take vitamin D and calcium, as well as other kinds of medications which may be appropriate to the symptoms that you're manifesting. Another common symptom of lupus is a lot of swollen joints, especially in the morning, and fingers. They could be swollen and sore, or they could be just, swollen. And usually when the weather changes, you feel a lot more symptoms. Or for women, especially when you're having your menstrual cycle, you have a lot more of the symptom, because that's when the production of the hormone is high. So that is it. I would like to also talk about the experiences that I have had as a lupus patient. I have suffered blood clots, I have had hair loss, I have had my nails dying. First they become so thickened, and then when you touch it, it turns into powder. And I have had my skin being just eating up. First it looked like a black spot, and then a blister, and then it starts eating up my skin. And then I've had ulcers in my mouth, and I've had such locked jaws that even speaking becomes so difficult. And then I've had lots of swollen joints, and chronic fatigue is one of the terrible things lupus patients suffer from. And that often, when not managed really well, and when people that are close to you don't understand, you tend to lose lots of relationship, because they don't understand why you were not able to make it to this meeting that we had agreed on, or why you came and you can't wait till the end because you're just complaining you're tired. Or if you're an employee, why you're not meeting your deadlines, why are you calling off all the time, and those kind of things. So it's very important that even human resource managers, employers understand how this condition works, that it is so unpredictable. You can be talking to the person fine, all right. The next hour or two, you can see them and they'll be a completely different person. Without understanding, you will say that they have faked it, or they are pretending, or they are lazy. However, that is not how it is. Autoimmune, so anything can happen. And depending on what the immune system decides to do, the person can't really do much. So the awareness is really, really important. Another thing is that lupus places a lot of risk on females, especially when you intend to get pregnant, or to procreate, because then you put your life at risk, and also the life of your unborn baby. Because mind you, even without the new baby forming, your immune system thinks that some of itself are foreigners that must be attacked. So now when a foreign thing is being introduced, then you know that they're going to be on greater alert. And so somebody that has lupus cannot just decide to be pregnant. It has to be planned with your doctor, so that they know that, okay, in 6 months' time, she's likely to try to get pregnant. So we need to take care of medications that may not be good for pregnancy, put her on more conducive one, and see if she's symptom-free for at least 3 months. And then we know that we can try out with a pregnancy. And so in a nutshell, that is what lupus is. As another opportunity, we can talk about how lupus affects the cardiovascular system, how it affects the renal system, how it affects the skin, lupus and men. We can take it in different topics and talk about But for now, this is just an overview of what lupus is, and I'm really grateful for the opportunity. I look forward to other opportunities. Let's all have a blessed day. Let's continue to stay safe, and let's continue to move with joy. Amen. Please also, I would entreat you to subscribe to Oyemam Autoimmune Foundation on YouTube, on Facebook, Twitter, and Instagram. Thank you, and God bless you.